There's two ways to prevent the virus. One is through not having any sexual contact, which is not realistic for most individuals. And secondly, it is to receive the vaccine. And the vaccine is a very effective prophylactic against several of the strains of this virus which cause a considerable amount of the problems related to HPV. The HPV vaccine is currently licensed and recommended for girls and boys starting at age 9 and continuing up to age 26. The vaccination involves a series of 3 injections which occur roughly over a 6-month time frame. The human papillomavirus vaccines that are available are incredibly effective at reducing the risk of disease caused by these viruses. At present, we estimate there's a 99% risk reduction in the chance that a cancer caused by one of the strains covered in these vaccines will develop in a person who has received the immunization. The human papillomavirus vaccine has been administered to over 30 million people. At present, there are no unusual risks associated with this vaccine compared to any other vaccine which has been administered. We want to get people vaccinated to HPV before they come in contact with the virus, and while their immune system can generate a very robust response to the vaccine that we're administering them. Those two factors allow the vaccine to be highly effective and virtually eliminate the risk that the high-risk strains of the virus, which are immunized against, will become a problem for that individual.
The prevention of these cancers really happens, 2 decades prior when you're a young individual. And I think the best thing that we have right now is the vaccine. I think that if the entire human population, let's say we could get everybody in the United States to get vaccinated at the appropriate age, before they were sexually active, these diseases would disappear in a generation or 2.
The greatest myth I'd like to dispel with HPV is that it's a socially stigmatizing disease. It's not. It's a virus which is shared by many, many, many of us in this population. And knowledge about the virus can allow us to manage the risk posed by it. So openly discussing it with your partner, with your healthcare provider, and trying to learn as much about it is really the best way to reduce your personal risk and reduce the risk of those you care about. Our hope is that human papillomavirus vaccinations will one day result in this virus and the cancers that it causes being eliminated.